Welcome to Module 1 of our course Medical Hematology, Bacteriology, and Parasitology. In this module, we focus entirely on medical hematology, the science of blood, its components, its disorders, and the laboratory methods used to study it. Our journey will take us from the origin of blood cells in the bone marrow, through the complex process of hemoglobin synthesis and breakdown, to the detailed steps of laboratory testing and diagnosis. I'll guide you in a way that builds both foundational knowledge and clinical application, so that by the end of this module you will feel confident in both theory and practice. 1. Origin, development, and function of blood cells. Let's begin with the very heart of hematology, blood cell origin and development, also known as hematopoiesis. Blood cells are produced in the bone marrow, a spongy tissue found in the cavities of long bones, ribs, sternum, pelvis, and vertebrae. This process begins in early embryonic life, first in the yolk sac, then in the liver and spleen during fetal development, and finally in the bone marrow after birth. All blood cells, red cells, white cells, and platelets, are derived from hematopoietic stem cells. These stem cells have two remarkable properties. Self-renewal, the ability to produce more stem cells, maintaining a constant supply. Differentiation, the ability to develop into specialized blood cells depending on the body's needs. The process of differentiation is tightly regulated by growth factors and cytokines, ensuring that we have just the right balance of red cells for oxygen transport, white cells for immunity, and platelets for clotting. Now, the functions. Red blood cells, erythrocytes, carry oxygen from the lungs to tissues and return carbon dioxide to the lungs. White blood cells, leukocytes, defend the body against infections, foreign bodies, and abnormal cells. Platelets, thrombocytes, help form blood clots to stop bleeding. Without precise regulation of hematopoiesis, anemia, immune deficiencies, or bleeding disorders can occur. 2. Synthesis and breakdown of hemoglobin. Hemoglobin is the oxygen-carrying pigment in red blood cells. Its synthesis is a multi-step process that occurs in immature red cells in the bone marrow, requiring iron, vitamin B6, and adequate protein supply. Structurally, hemoglobin is composed of heme, an iron-containing porphyrin ring, and globin chains, which are proteins. The type of globin chains determines the type of hemoglobin, such as fetal hemoglobin, HbF, or adult hemoglobin, HbA. When red cells reach the end of their lifespan, about 120 days, they are broken down in the spleen, liver, and bone marrow. The heme portion is converted to biliverdin and then to bilirubin, which is excreted in bile. The iron is recycled and used to make new hemoglobin molecules. Disruptions in this process can lead to disorders such as anemia, thalassemia, or jaundice. 3. Methods of hemoglobin estimation. In hematology, measuring hemoglobin concentration is a routine but crucial test. It helps in diagnosing anemia, polycythemia, and monitoring patients under treatment. Common methods include cytomethemoglobin method, the gold standard in many labs. Oxyhemoglobin method, measures hemoglobin bound to oxygen. Automated hematology analyzers, provide fast, accurate readings. The choice of method depends on available equipment, the need for accuracy, and patient condition. 4. Methods of cell counting and absolute values. Cell counting is essential for assessing the patient's hematological status. Manual methods, using a microscope and a hemocytometer, are still used in resource-limited settings, but automated counters dominate modern laboratories. Absolute values, such as total white blood cell count, total red blood cell count, and platelet count, provide direct information. In addition, derived indices like mean corpuscular volume (MCV) and mean corpuscular hemoglobin concentration (MCHC) help classify anemias into microcytic, normocytic, or macrocytic types. 5. Introduction to hemostasis. Hemostasis is the process that stops bleeding while maintaining normal blood flow elsewhere. It has three main stages. Vascular spasm, constriction of the injured blood vessel. Platelet plug formation, platelets adhere to the injury site and stick to each other. Coagulation, clotting factors produce fibrin threads that stabilize the platelet plug. Failure in hemostasis can result in excessive bleeding or dangerous clotting. 6. Principles and mode of action of common anticoagulants. Anticoagulants are substances that prevent clotting, essential for collecting blood samples without them coagulating before analysis. Common examples. EDTA binds calcium, preventing clot formation, ideal for complete blood count. Citrate also binds calcium, used for coagulation studies. Heparin enhances antithrombin activity, used for blood gas analysis. 7. Principles and components of hematological stains. Microscopic examination of blood requires staining to differentiate cells. The Romanowski stains, like Wright's, Gimsa, and Leishman, contain acidic and basic dyes that bind to different cell components. For example, eosine stains hemoglobin and granules pink, while methylene blue stains nuclei blue-purple. 8. Simple tests used in blood coagulation. Basic coagulation tests include prothrombin time, PT, evaluates the extrinsic and common clotting pathways. Activated partial thromboplastin time, APTT, measures intrinsic and common pathways. Bleeding time, assesses platelet function. 9. Blood films, normal and abnormal. A blood film is a thin smear of blood on a glass slide, stained for examination. Normal film, uniform red cells, normal size and color, appropriate white cell differential, and normal platelet number. Abnormal film, variation in red cell size, anastocytosis, shape, poikilocytosis, or color, hypochromia, abnormal white cells in leukemia, or platelet abnormalities in thrombocytopenia. 10. Identification of blood cells in disorders. Laboratory scientists must distinguish normal from abnormal cells. For example, sickle cells in sickle cell anemia, target cells in thalassemia, blast cells in leukemia. Correct identification guides diagnosis and treatment. 11. Theory and application of hematology procedures. This includes both manual and automated techniques for cell counts, hemoglobin estimation, coagulation testing, and blood typing. Proper sample collection, storage, and handling are as important as the testing itself. 12. Mechanisms of hemostasis, summary. Hemostasis involves a delicate balance between procoagulant and anticoagulant forces. Disturbances in this balance can cause clinical disorders such as hemophilia, deep vein thrombosis, or disseminated intravascular coagulation.